At CNWL, we aim to provide high-quality care. So we've been redesigning our teams to improve our mental health services in North West London. We've listened to our patients and other people who use our services and understand what they've been telling us. We know having lots of different ways to access services made it all quite confusing in the past. And things like having to repeat stories, feeling stuck in our care for too long, and services not being open when they're needed, all meant the system used to be difficult to navigate. With all this feedback in mind, we've had a rethink. We worked with patients, carers, GPs, commissioners, social care and other people who use our services to transform and improve them. That's co-production. What's great about it is there's now no wrong front door into our services. It all starts with a single point of access. That's one telephone number to reach all adult community mental health services. You just call and they arrange for you to see the right professional at the right time. Trained mental health staff answer calls to make it all happen. They're friendly and helpful and support patients as they move through the system. GPs, other services like the police and the London Ambulance Service, the voluntary sector, housing associations, as well as other professionals, can all refer patients. So when Carlos, who suffers from anxiety and depression, tells his GP that the medicine he takes isn't working, she calls the single point of access to ask for a review. They book an appointment for Carlos with the community mental health team. He's assessed and treated by the same team, so no having to repeat his story time and time again. People can also call for advice about their needs, or about a family member or friend, 24 hours a day, 7 days a week, so it's really flexible. In the case of Anne, who cares for her daughter and is feeling a bit isolated, she's able to call to ask for help herself. When she tells the single point of access staff she used to be part of a carers support group, they're easily able to search a huge directory of different services and find her a new, local group. If there's a real crisis, we've introduced rapid response teams that can, respond rapidly, day or night, 7 days a week. This means no one's ever left alone when things get really tough, and can be seen at home without needing to go to A&E. So when Omar, who has schizophrenia, becomes unwell, his sister telephones the single point of access at 2 in the morning. Aisha's seen Omar like this before, so she's really worried. Staff at the single point of access talk to Aisha and Omar and arrange for a rapid response team to see him that night. Whereas in the past Omar would have had to go to A&E, the rapid response team come to assess him at home to keep him safe in the short term. They provide advice and support to his sister too. All of this gives Omar a better chance of recovery and helps him get back to normal life sooner. All of these changes help empower patients and enable people to be more independent in managing their own health and well-being. That's why our community teams have been transformed. Like with Omar, they help patients achieve their recovery goals and make sure patients get a big say in how they're treated. That happens by making everything personalised and tailored to each individual. With more support in the community, which helps people stay close to family and friends, there aren't any big gaps in care. And when more intensive care is needed, that's available too. So with everything we've done, from a single point of access to longer opening hours and new, more responsive teams, our adult community mental health services should now serve people even better than before. You can find more information on our website. We're always here to help.